Before starting my demonstrations of self-manual lymph drainage, I want to share some drawings from my longtime friend Dale Anderson, which I have found to be very helpful in explaining some of the underlying causes of lymphedema. For starters, let's look at an illustration of a normal lymphatic transport system. The blood, carrying nutrients and oxygen to our cells, rushes down the arteries and filters into the tissue. This is called filtration. It is then picked up by the veins for return back into the circulatory system, and this is called resorption. However, there is a certain portion of the blood that is not picked up by the veins for its return to the circulatory system. It is left for transport via the lymphatic vessels, or lymphatic transport system, to the lymph nodes for filtering. This unfiltered waste is referred to as the lymph load. In addition to metabolic waste, it may include dust, dyes, pollens, bacteria, viruses, and even cancer cells. In fact, it is more appropriately called the LOL, or lymph obligatory load, because it has to be filtered and rendered harmless before it can be returned to the bloodstream. In a normal functioning system, the lymph transport system is 10 times greater than the lymph load. This is referred to as the safety valve factor, inherent protection from an obstruction or inadequate transport system, and or an abnormal increase in the lymph load. A simple example might be a sprained ankle with noticeable swelling in the area, referred to as acute edema. Thanks to a normal safety valve factor, the swelling will subside in a relatively short time. If the same person had a compromised transport system, such as an inguinal node dissection in his past history, there would likely be a different outcome. Quite probably, the swelling would not subside, and the injury could be enough to push the patient into a chronic condition called high protein lymphedema. The lymph transport system was already compromised, and the increased lymph load simply overwhelmed its ability. This safety valve factor is critical for lymphedema patients, and it needs to be well understood as to how this ratio can change under different circumstances. So what happens when there's increased filtration? This can change dramatically just by hot weather. I'm sure you've noticed how flushed you get when you're overheated. On a hot day, you'll likely have vasodilation, or dilation of the blood vessels. As the vessels dilate, blood flow increases, which means so does the lymph load. Hot weather can be problematic for lymphedema patients, which helps us understand why they would be better off in a swimming pool rather than lying in the sun. Besides, the exercise, even if it's just walking in the cold water causing vasoconstriction, is helpful. Plus, the hydrostatic pressure of the water against their skin, which is a form of compression, will also help to minimize the lymph load. The deeper the water, the greater the pressure, so standing in 4 feet of water will be more helpful than standing in 1 foot of water. This realization was the underlying discovery that evolved into the gradient that is an integral part of all compression stockings. It is not uncommon to see lymphedema secondary to chronic venous insufficiency. Anytime there's an obstruction in the venous return of blood, such as a vein stripping or a deep venous thrombosis, or DVT, the backup can overload the lymphatic transport system, and I must add at this point that a DVT, as well as congestive heart failure, which initially shows up in the feet and ankles, are absolute contraindications for manual lymph drainage. That means you do not do manual lymph drainage on these patients. Since manual lymphatic drainage is no longer an option, lymphedema patients with these conditions may choose some type of containment of the swelling, such as a daytime compression garment. But even compression for these patients is only possible with the consent of the patient's doctor. You hear a lot about primary lymphedema, which simply means that a person wasn't born with enough lymph vessels or may have some kind of malformation in the lymphatic transport system, which ultimately affects its ability to efficiently handle the lymph load. Manual lymph drainage can be helpful, but it usually requires a lifetime of daytime compression garments. It is also called primary lymphedema as it was not caused by an external insult, such as an injury, surgery, or radiation. It is an ongoing struggle for lower extremity lymphedema patients as gravity is working against them every step of the way. Their best control is a healthy diet, weight management, and proper exercise. This illustration of secondary lymphedema is my favorite. My own lymphedema was the result of radiation and surgical intervention. In other words, secondary lymphedema is the direct result of an outside interruption of the lymphatic transport system. This is the basis for manual lymph drainage, or MLD, as it attempts to bypass the insult by creating new pathways with frequent, gentle stretching of the lymph vessels, most of which are just beneath the skin. Secondary lymphedema can also be caused by a traumatic injury. I had a patient who dropped a chainsaw on his medial thigh. I don't have to tell you what that did to his lymphatic transport system. Before we move on, I want to make sure you, as lymphedema patients, understand the connection between transport capacity and lymph load, no matter what the insult is. So think about this. Immediately following your cancer surgery or removal of lymph nodes, as they wheeled you out of the operating room, did you wonder what just happened to your safety valve factor in your affected limb? No, you were probably unconscious, but let me tell you, I seriously doubt it was still 10 to 1, and it probably never will be. Was it a 7 to 1? A 2 to 1? Another consideration is what happens to this ratio as we age. We lose the elasticity in our skin, which is one of the two key components of fluid resorption back into the circulatory system. In other words, what is forcing this lymph fluid back into our system? Combine that disappointing dilemma with the fact that for years we've overloaded our systems with inflammatory foods and poor digestion, which all add to the lymph load. When we get to a 1 to 1 or a 1 to a -1, that is when the trouble starts. The good news, however, is that by learning self-manual lymph drainage and making a commitment to regular self-MLD therapy, you can actually increase your transport capacity. So now just think about this. Through proper dietary changes, you can even reduce your lymph load. And voila, up goes your safety valve factor. The other key component of fluid resorption is atmospheric pressure, which is 14.7 pounds per square inch at sea level. The higher up you go, the less pressure there is against your skin, which helps to explain why we all tend to swell, particularly our feet and ankles when we're on an airplane or hiking at high elevations. For patients struggling with lymphedema, however, it is wise to either protect the affected limb with short stretch bandages or wear a compression garment on long flights or hiking at high elevations. The other thing I want to make sure you understand is that the real culprit in lymphedema is the trapped proteins and not the water. Those proteins which actually attract water can no longer be removed from the tissue by damaged or inefficient lymphatic vessels. This is why lymphedema is often referred to as chronic high-protein edema. These proteins coalesce and become the foundation of the fibrosis or internal scarring. Water is the carrier or the way out for these trapped proteins, which explains why a diuretic can often add to the problem. Stay hydrated. Do your best each day to drink a half ounce of water for every pound of your body weight. In other words, if you weigh 120 pounds, ideally, you should consume at least 60 ounces of water each day. And no, coffee and alcohol are not substitutes. They actually dehydrate you. If you have long-standing lymphedema with noticeable fibrosis or thickening of the tissue in your affected limb, making it difficult or impossible to stretch the skin, I encourage you to spend some time with a skilled lymphedema therapist who can show you a safe and effective technique for softening this indurated tissue. It requires more pressure at a different pace, which is why you may want to let the therapist do it for you, softening the tissue so you can move forward with your self-MLD with greater confidence and faster results.